my brothers, my sisters, my fathers, my mothers, my colleagues, my neighbors, all of us, I greet you. You are welcome again to my show. I am Dr. Jolo, your host in the show DJM3, Dr. Jolo Musical Medical Mission. Today we are going to talk about a very important topic, and I'm sure all of you will gain a lot from this topic. The topic concerns more the women, whether you like it or not. Even if you are as a man, you have a mother, you have a sister, you have a wife, you have a cousin that is a female. That's why even as a man, you must also listen to this. We'll be talking about breast cancers. It's a sober topic because a lot of casualty from this illness ought not to be. We don't have to go through all this stress of having people die unnecessary death. It's not worth it. You know what? The commonest cancers amongst women is breast cancer. And incidentally, before it can become manifest, it shows itself in some ways. But a lot of the women they take things for granted. These are issues that we are going to talk about. These are issues we are going to address today. Well, what is breast cancer? First, before I say cancer, I want to talk about tumor. What is a tumor? A tumor is a new growth within the body. And for the breast, a tumor is a new growth within the breast tissue. The tumor, when it is there, it can be innocent, can just be a tumor that is innocent, that cannot harm you. It can also be a dangerous one, a malignant tumor. This is what brings us to breast cancer. What causes it? Foremost, I want you to know that it runs in families. If a woman has a sister or a mother or a twin sister who has breast cancer, she is more likely to have it. So she must be out on the watch to screen herself, particularly as she is getting older. It runs in families. It's also genetic, and there are certain things that predisposes one to having breast cancers. The diet. We notice that people that engage more in fatty diet tend to have breast cancers. We notice that people that abuse alcohol tend to have breast cancers. We notice that people of socio-economic level, I mean poorer people, have tendency to have breast cancers. Likewise, if there is inflammation within the breast in form of trauma, if the person has injured the breast before, if it wasn't properly treated, it can also cause breast cancer. It can come in form of breast cancer. And according to some research, they've discovered that the use of contraceptive pills have been incriminated in the formation of breast cancers. How do you know that you have breast cancer? Screening. Screening. How do you screen it? It's a simple procedure. When last did you examine your breast as a woman? When last did you examine your breast? How do you examine your breast? You have to touch your breast. You have to feel if there is any lump in it. You know, the way breast cancer manifests, the first presentation is a breast lump. The lump can be one, it can be multiple, it can be solid, it can be fixed. It can be fixed to the to the chest wall, it can be fixed to the skin. It can have nodules, it can have holes, what we call holes. It can have the hair follicles will be more visible. But foremost, you just have to, if you see any nodule, or if you see any lump in your breast, that's a pointer that possible it could be a breast cancer. So, how do you do this? The first line of treatment is to remove the lump. Any lump that you see in your breast should be removed. And it's not only removal that's the solution. You have to take the lump to the surgeon will take the lump to the pathologist. The job of the pathologist is he will take the lump to the laboratory. He will examine the lump, and there are some tests we'll carry on the lump that will tell us whether the lump is an innocent lump or the lump is a malignant one. If it is innocent, we don't have much to worry about. But if it is malignant, we have something to worry about. Then we need the help of the surgeon. The surgeon will have to go to the breast, to the table again, examine the patient. In most of these cases, we recommend the removal of that breast. And the removal of the breast, because depending on what the pathologist has told us, the specialist doctor, whatever he has told us, we tell the surgeon the how how vast the surgery may be. At times, the surgical operation may involve some parts of the axilla, the armpit. They will go there to remove some of those things they call um, some lumps. There may be some lumps in the armpit. They'll go to that extent to remove the lumps. And apart from surgery, we are talking about radiotherapy. Radiotherapy is the use of radiation to treat cancers. The radiotherapists know what they do. They radiate that area, they radiate the chest wall, they radiate the armpit. They make sure that all the cancer cells are killed. Having done the radiotherapy, there must be follow-up. And after this treatment of radiotherapy, we must still commence the use of hormone. That is where we continue with the use of tamoxifen. Hormone, we use the use of tamoxifen. Tamoxifen is an estrogen, is a sex hormone receptor blocker, because we believe that there are some sex hormones that encourage cancer cells within the breast. So when you use the tamoxifen, daily usage of tamoxifen, when you use it, we know, we believe and we know that it blocks the growth of the cancer cells. Now, the beauty of the whole thing is that no matter the malignancy, no matter the cancer, the important thing is that early treatment, and the best time to treat cancer is the first time. When you treat early enough and you give the treatment, you are very aggressive about the treatment. Yeah, in some of the cases, I won't say all the cases, in some of the cases, the patient the outcome will be successful. So apart from hormone therapy, there's a new technology, call it immunotherapy. Immunotherapy is still in developmental stage, but I don't want to bother us with too much of this. But what I'm just trying to let you know is that breast cancer has come, and it is important that you screen yourself for it, so that even if you have it, you take care of it before it takes care of you. It gets the worst out of you. And another note, I want you men folks to realize that men too do have breast cancers. Men have breast cancer, but it is commoner in women. And usually, when it shows itself, it comes up as a form of lump, a hard lump. That by the time it shows it, it is more aggressive in men, because men do not have it. A lot of men will not want to believe that they can have breast cancers. We have seen some men having it, and usually the treatment also is surgery, radiotherapy, and chemotherapy. Ladies and gentlemen, I hope you have enjoyed this my talk about breast cancers. If you have any questions at all, be free to ask me. I thank you very much for listening to us, and I hope this has added value to your knowledge about this medical emergency. Thank you very much. Enjoy yourself. Having said any questions, you can see the number on display. You are at liberty to send your questions to the numbers, and it will be my pleasure to address your questions and answer you appropriately. Ah, the day is well spent. I hope all of us have enjoyed this day. I look forward to your feedback. What else? What else remains? But for us to go to the next room, and you know the room we are going to, let's listen to music. Let's relax. Let's have fun. Life is good. Life is beautiful. Please join me in the horror room. Let's listen to some jazz with some African touch. Thank you very much. You are welcome again, ladies and gentlemen, my viewers, to this show, DJM3. Now, I want us to remember those people, this set of people that are responsible for what we eat, that gives us health. When I'm saying this, I'm talking about the farmers. And the next song we are going to have here now is in respect and in honor of our farmers, because they are the ones that provide for us food that we eat the plants that we eat, the animals that we eat. And on this note, I'll be singing this in Yoruba. And this is Iṣẹ́ àgbẹ̀ níṣẹ́ ilẹ̀ wa, ẹni kò ṣiṣẹ́ á máa jalè. Ìwé kíkọ láìsí ọgbọ́n àti àdá kò ì pé o, kò ì pé o. Iṣẹ́ àgbẹ̀ níṣẹ́ ilẹ̀ wa, ẹni kò ṣiṣẹ́ á máa jalè. Ìwé kíkọ láìsí ọgbọ́n àìsí àdá kò ì pé o, kò ì pé o.
Thank you.